Let's be real, in an emergency, knowing what to do can literally be the difference between life and death. But what if the plan was simple enough to remember, even when you're under a ton of pressure? Well, over the next few minutes, we're going to break down the essential first aid framework that can help you stay calm and take control. Let's dive in. I want you to picture this for a second. You're just walking down the street and boom, you witness an accident. Someone's hurt. Your heart starts pounding, right? What do? It's a question that gives a lot of people anxiety. But honestly, having a clear plan is the #1 way to overcome that fear and actually take effective action. Okay, so before we even get into the step-by-step stuff, we have to talk about the mindset. Every single decision a first aider makes is guided by 3 fundamental goals. If you can understand these principles, you've got the foundation for everything else that follows. And here they are, the 3 P's of first aid. Super simple to remember: preserve, prevent, and promote. Think of these as your mission, your North Star. They tell you exactly what to focus on and in what order, no matter what's happening. First up, preserve.
First and foremost, the absolute top priority is to preserve life. It's that simple. This means your first actions have to focus on any immediate, life-threatening conditions. We're talking about a blocked airway, severe bleeding, or if someone's heart has stopped. This is, without a doubt, the most critical goal.
All right. Once you've dealt with those immediate threats, your goals shift a little bit. Now it's all about preventing things from getting worse. And that means 2 things. First, making sure the area is secure so nobody else gets hurt. And second, stabilizing the person so their condition doesn't deteriorate while you're waiting for the pros to arrive.
And finally, our 3rd P is to promote recovery. Now, this involves providing comfort, managing pain, and doing basic treatments, like bandaging a wound. These actions might seem small in the moment, but trust me, they play a huge role in a person's healing process and their overall outcome.
So that's the why, the whole guiding philosophy behind what we do. Now, let's get into the how. A clear, practical action plan that you can actually follow when the pressure's on. And it's called DRSABCD. This acronym is so much more than just something to help you remember. It's your emergency checklist. It makes sure you do the most important things in exactly the right order, which helps turn that feeling of panic into a focused, calm procedure.
First, and I can't stress this enough, D is for danger. Before you do anything else, you stop and you look around. Is there traffic, a fire, downed power lines? Your own safety always comes first. You can't help anyone if you become a patient too.
Next up is R for response. You're going to kneel down beside them, give their shoulders a gentle tap, and ask loudly, "Can you hear me? Open your eyes." How they respond, or if they don't respond at all, is going to tell you exactly what to do next.
So what if you get no response? Your very next move is S, for send for help. Do not wait. Call for help yourself. If other people are around, don't just shout, "Someone call an ambulance." Be specific. Point to one person and say, "You in the red jacket, call for an ambulance right now and come back and tell me they're on their way." This gets help rolling while you keep working.
Now I move to A for airway. This is so important. When someone is unconscious, their tongue can actually relax and fall back, blocking their throat and stopping air from getting in. All you have to do is place one hand on their forehead, 2 fingers under their chin, and gently tilt the head back. It's a simple move that lifts the tongue and opens that airway right up. With the airway open, we check B for breathing. For no more than 10 seconds, you're going to look for the chest rising and falling. Listen for any sounds of breath and try to feel their breath on your cheek. If they are breathing normally, you'll roll them into the recovery position, which helps keep that airway protected.
But if they are not breathing normally, we go straight to C for CPR. You begin chest compressions immediately. By pushing hard and fast in the center of their chest, you're basically doing the heart's job for it, pumping blood to the brain and other vital organs, which is literally keeping them alive until help can take over.
And finally, that second D stands for defibrillation. If there's an AED, an automated external defibrillator available, use it. These things are designed for anyone to use. You just turn it on and it talks you through the whole process. An electric shock from an AED can actually restart a heart, and it's an absolutely crucial link in the chain of survival.
Okay, so we've got the principles and we've got the action plan. But what does all of this actually look like when the pressure is really on? Let's walk through a quick scenario just to see DRSABCD in action.
So, meet James. He's trained in first aid, and he just saw a serious accident. A pedestrian is down. they're unconscious, and they're bleeding. It's a chaotic scene, but because he has that training, he knows exactly which framework to fall back on.
His training just kicks right in. He doesn't panic, he starts the plan. First, D for danger. He sees the ongoing traffic and knows his first move has to be carefully getting that person to a safer spot. He's protecting them and himself from any more harm.
With the scene now secure, he moves right on to R for response. He checks to see if the person is conscious. They're unresponsive, so he immediately goes to A, opening the airway to make sure they can breathe. You see? He's following that sequence perfectly.
Now, notice what he does here. He delegates. Knowing that getting professional help is absolutely critical, he tasks a bystander with making the call. That's our S for send for help. This frees him up to keep going and start controlling that severe bleeding, which directly addresses that #1 goal of preserving life.
That whole scenario just brilliantly shows the power of having a plan. James went from being just a bystander to an effective first responder simply because he knew 2 core frameworks.
And this is really what it all boils down to. This is your toolkit. The 3 Ps give you the right mindset, your strategic goals. And the DRS ABCD action plan gives you the tactical step-by-step guide to actually get it done. Together, they turn confusion into confident, life-saving action.
So, the next time you're faced with that question, what is my first move? You have the answer. You've got the mindset and you've got the plan. So the only question left is, are you ready to be the person who steps up and makes a real difference?